want you to imagine being fully awake, but you can't move. Someone can ask you a question, and your thoughts start to stutter. You can't even get them out. Your mind and body are frozen. This is what can happen when someone's catatonic. I'll never forget meeting my first catatonic patient. I walked into his hospital room, and there he sat, completely frozen. I lifted his arm up, but it didn't fall as expected. When I took the pillow from behind his head, it didn't fall back down. I would ask him questions, but he would remain silent, looking straight ahead. But 15 minutes after giving him an injection of a medication, he was back to eating fruit as though nothing had happened. And this is just one way that catatonia can manifest. It is a very fascinating and still poorly understood mental health condition. And it's one that we're diving into today. And for those of you new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And on this channel, I enjoy making educational mental health videos. And as always, these are educational videos, not medical advice. And of course, if you are experiencing any mental health symptoms, please seek the care of a mental health professional near you. So let's start off with what catatonia is, because it is a very perplexing, mysterious, and still poorly understood condition that does have some treatments, but if not treated in time, can be very life-threatening. I think many people have some sense of what catatonia is, maybe from movies, kind of this idea of kind of being stuck, right? And it maybe being caused by a mental health condition. And people are struggling to move, to think, and sort of acting like statues. And sure, those are some features of catatonia, but that is definitely not the full explanation of it, or the only way that it can manifest. At its very core, catatonia is a disruption in the brain's GABA system. And just to give you an overview, the brain has these two neurotransmitters called glutamate and GABA. And glutamate is kind of like the on neurotransmitter. It's how your brain cells communicate to be more active, to turn on. And then there's GABA, which is the opposite. It tells your brain cells to slow down, reduce signaling in the brain. And there's always this ongoing balance in the brain between glutamate and GABA. And GABA, this kind of slowing down neurotransmitter, can also help smooth out movement, help with communication, speaking, even thinking. Same with glutamate. And on a very basic level in catatonia, there's a reduction in the GABA. And it's almost like the brain sort of gets stuck. So people's movements slow down, their ability to think, produce speech, interact with others also gets diminished. I'll come back to this explanation in a moment because it also illustrates how catatonia manifests and why some of the treatments work for it. But first, let's jump into a case. I'll call this patient Brian. And he was one of the first cases of catatonia that I treated in my psychiatry residency. And of course, as always, whenever I talk about patients on this channel, all details have been greatly altered to protect patient privacy. So before I ever met Brian, he was a 20-year-old college student going to a local university, and by all accounts had a promising future ahead of him. He was actually the first in his family to go to college, so everybody was kind of rooting for him, very proud of him. He was being raised by a single mom. And at first, his freshman year, things were going relatively okay. He lived in a dorm, no issues, no concerns. But as his sophomore year progressed, some warning signs definitely started to arise. His roommates started to notice that he wasn't leaving his room as often. He also wasn't showering that often. They actually started to notice he was smelling bad. He wasn't really greeting them in the common area. And just kind of started to withdraw more and more. Eventually, he stopped leaving his room altogether. He started to lose weight. And once he stopped eating, definitely the counselors were called, the RA for the dorms, his family got involved, and eventually they brought him to the hospital. And very quickly, the physicians in the emergency room realized something is really wrong with him. Let's admit him to the psychiatric hospital for further evaluation. And of course, because this was so unusual, he had a full medical workup, brain scans, the full medical neurologic workup, and everything came back normal, as is often the case in catatonia. And initially, even on an inpatient unit, we thought maybe this was a severe case of depression, or maybe even schizophrenia, psychosis. That's why he wasn't showering, growing more withdrawn, maybe a little bit paranoid as well. And then once we actually performed tests to evaluate for catatonia, which I won't fully go into in this video, it became clear, yes, Brian was definitely catatonic. If we lifted his arm, it would kind of stay up and slowly float down, responding very little, eating very little. And he did have some paranoia, but it was often clouded just by his withdrawal from everything. All he would do is stare out the window and mumble a few words if you asked him something. So the diagnosis became very clear, catatonia. Exactly what was causing it was still unclear, and I'll get to that in a moment, but we knew the diagnosis. And that was something, right? Not exactly. Because he was so catatonic, he wasn't able to agree to treatment. He wasn't able to consent to the main treatments, which would be Ativan injections or even taking a pill of Ativan. He wasn't taking any medications, was refusing everything except very minimal food. And so we had to take him actually to mental health court to force treatment on him to save his life. Before we continue with Brian's case and even some more dramatic cases I've seen of catatonia, let's take another step back and evaluate what catatonia is. So in this case, it's a very kind of classic withdrawing, not moving, growing very stiff case of catatonia. Remember how I said we knew there was catatonia, but we weren't exactly sure what was causing it. And that's because catatonia can be caused by many things, and not just mental health conditions. Of course, the most common mental health conditions to cause it include depression, bipolar disorder, and schizophrenia, among others. But it can also be caused by neurologic diseases. And that's why getting brain scans, a full neurologic workup was so important for Brian. Even things like autoimmune encephalitis can classically cause catatonia. So two different people can look identical in their presentation of catatonia, but two very different things can be causing it. I want to make that clear. Why is treating catatonia so important? Why is it that we were taking Brian to court to basically force treatment on him against his will? The reason is it can be very life-threatening. And why is that? It's because one, you can stop eating, right? You withdraw so much that your body starts to shut down for malnutrition. That's definitely one reason. Dehydration can be another major issue. Another concern that arises is that when your muscles are stuck in a position like that, they start to actually break down. And then some of the proteins that are released can actually shut down your kidneys. So it can actually be that your kidneys start to shut down and then your other organ systems shut down as a result of this. And then of course there's the impact right on your life. If you're frozen, you can't engage in life. You can't go to work. Your relationships fall apart. There's all these other sort of implications from catatonia as well. Now I want to jump to another example to kind of reveal a different way that catatonia can manifest. And I'll call this patient Jay. And Jay I also met on an inpatient psychiatric unit. And as you can probably tell, those are where the most acute cases of catatonia typically tend to present. But her catatonia was very different from Brian's. Instead of laying in bed, being stuck in a single position all day, she was walking around the unit all day, much of the night as well. She was pacing back and forth, and she would repeat these phrases over and over again to the great irritation of the staff and other patients. I definitely felt bad for them. This was another example of catatonia, but one where there is more activity. And it's not that you're stuck in position, but you're stuck on repeat. Now I'll introduce another case to you before tying them all together. And this is about a patient I'll name Kaitlyn. Also, I've encountered her on the inpatient psychiatric unit, and she had a much more subtle case of catatonia. This case is really important because it highlights how easy catatonia can be to miss. Kind of like Brian, Kaitlyn was a bright college student, early 20s, going to school. And also kind of like with Brian, her roommates were the first ones to notice that something was off with her. Again, she was spending less time leaving her room. She was not attending classes, not going out as often. So she was also brought to the hospital, much against her will. She was very adamant she didn't want to go, grew kind of combative in the emergency department, saying there was no reason for her to be there, though everybody else in her life thought that she definitely needs to be there. And again, she also received a full neurologic and mental health workup. And everything came back completely normal, except of course her behavior, her personality. That was not normal Kaitlyn. When I would meet her in the morning on rounds, I would walk into her room and I would always find her reading a self-help book on habits. First I thought, okay, that's a good thing, that's progress. Walking into a patient's room in the morning and seeing them reading a self-help book, that's usually a good thing on the inpatient unit. But she was there for a few weeks, and after the first couple of days there, I noticed she was still on the first chapter of the same self-help book. And I would run into her in the hallway and she would still be reading the self-help book and still be on the first chapter. So I asked her about what she was reading. She would kind of give me the same stock responses, like, I gotta work on my habits, I need to work on my routines, I need to work on my sleep, I need to work on my habits, my routines. It would be a little bit repetitive. And sometimes when I would ask her a question, she would repeat it back to me. Not in the same exact way, but in a similar way, kind of throw the question back at me. At first I thought, that's just maybe how she interacts, then maybe that's her deflecting the questions, being anxious, or something else. But another feature of catatonia is that sort of repeat nature of it, getting stuck on it, can also result in echolalia. Echolalia is a fancy term meaning basically the repetition of a sound. So patients can start to repeat what you say to them or what they hear. It's not always exactly the same, but it can be pretty similar. And that's what was going on here. And then when I looked at her book, I saw she was underlining and highlighting the same places over and over again. So again, that kind of included me in that's a lot of odd repetitive behaviors. Unlike with Jay and Brian, she was actually open to taking medications. She didn't oppose them. So we didn't have to go take her to court to force medications or treatment on her. So what we did is we asked her to take this medication called Ativan, lorazepam. It's a benzodiazepine typically used for anxiety, but in states of catatonia, it can be a very effective treatment. Typically, Ativan, just to give you a sense, slows you down, reduces anxiety, can make you fall asleep, things like that. But in catatonia, it tends to wake you up. So again, this goes back to the idea of GABA. And in patients with catatonia, recall, there is a reduced level of GABA in their brains. That molecule that sort of helps slow things down, modulate things, that's reduced. And typically, a medication that increases GABA slows things down, right? But in catatonia, what it does is sort of allows a more even balance. And so people start to wake up more. So this medication that typically reduces anxiety, makes you sleepy, makes you very sedated, in states of catatonia, it actually wakes you up a little bit because it's rebalancing that level. It's allowing for more smooth communication in the brain. So let's wrap all these cases together. It's kind of these three examples of catatonia, they're very different. There's Brian, who's very much that frozen form of catatonia, not moving, not interacting. There's Jay, who's walking around, very hyperactive, repeating the same things over and over again, never stopping talking. And then there's Kaitlyn, who's a little bit more of a mystery and takes a little bit more time to diagnose it accurately. But the treatments remain relatively the same for catatonia, no matter the case. It's usually using a benzodiazepine like Ativan. And oftentimes that is enough to improve people. You basically have to keep people in high doses of this medications, sometimes for weeks or months, and then slowly taper it off in the outpatient setting. So you don't keep people in the hospital during all of this. You can discharge them home and have someone give them the medication, and then things improve, gradually they resolve, and sometimes can flare up again. You might have to go back on Ativan, so it's different for everyone. But with the three cases I mentioned, with Brian, with Jay, with Kaitlyn, those were severe enough, and the improvements with Ativan were minimal with Kaitlyn, and Jay and Brian refused to take any Ativan, that we actually opted for electroconvulsive therapy. I recently made a video on ECT, definitely check that out if you're interested in it. But electroconvulsive therapy, or shock therapy, where you run a current through someone's brain to induce a seizure, under anesthesia, of course, is by far the most effective treatment we know of for catatonia. So with Brian and Jay, we took both of them to court and were able to get ECT approved. We had to force that on them the first few times, but after the first week or two of treatment, they came back more to themselves. They were able to actually engage, have a logical conversation, and then they consented to the treatment because they saw, okay, I'm starting to feel more like myself. Where was I for the past 2 months? All of these kind of things. With Kaitlyn, she volunteered for electroconvulsive therapy, did that electively, and that went really well too. She was able to discharge after a week and a half of electroconvulsive therapy and get back to school a month later. And why does ECT work so well for catatonia? Well, the answer is we don't know. We know it works really effectively, but we're not fully 100% sure why that is. And that's mental health for you. A lot of our treatments, we know a lot of them work. If you had to ask us exactly why they work, we don't know yet, at least not yet. So in closing, I hope you learned something about catatonia. One, that it's a condition that can affect the brain. Many things can cause it, and it can take on different forms, and it can be life-threatening if missed. So it's always important to have that on the differential as a mental health provider as something that could be going on, especially in very odd, unusual cases. I think a really fascinating point with catatonia is it does illustrate how the brain creates the mind, and any disruption in how the brain functions, in this case how GABA is regulated, has a profound effect on the mind, on the body, on your interaction, on your perceptions. And a condition like catatonia can really reduce your sense of self. Because in all of these cases, Brian, Kaitlyn, Jay, they became a shell of themselves. They became a very small, limited portion of who they are as people. They just became these very stereotyped, one-dimensional individuals without much personality, without much of anything of what defines them as a person, other than maybe their physical appearance. And I think that can be terrifying of how easily that can happen, right? Because as humans, we hold our sense of self or personality or memories or ability to interact with others as the core foundation of who we are. Catatonia can completely rob you of that. And perhaps to a lesser degree, other mental health conditions that constrict who you are can do the same. So I hope you found today's video interesting and informative. If you did, please like and subscribe. This is still a new YouTube channel, so any likes, comments are greatly, greatly appreciated. And I hope to see you back next week for another mental health video. Thanks.